Hi everyone. So I'm coming to you live from my living room. I wanted to put a video in just real quick because I'm going to be uploading these videos to YouTube and I want to make sure I credit the material I'm using. So I'm getting all the information from our Introduction to Medical Terminology by Anne Ehrlich and Carol L. Schroeder. So if you are following along and you are just finding this on YouTube, this is the book we're using. We're going to continue on with the peripheral nervous system, some specialists, and then also some conditions. But before we get into that, I just want to do a brief recap of what we went through. So I'm turning the camera off. Goodbye. And we'll continue on with our PowerPoint. So real quick, recapping the nervous system, what we've already been through. We talked about the two divisions, central nervous system, peripheral. Central being your brain and your spinal cord, and then your peripheral nervous system being anything that branches out. So that would be things that connect to your hands, your feet, your legs. These are housed in your spinal cord and they're transmitted. The messages are transmitted to and from your spinal cord from your extremities of your body. We went over some of the terminology. You can do this on your own track. Big thing, ascending and descending nerve tract. Be sure to know what those mean. Ascending means it's going towards the brain, and descending means it's going away. Receptors, receiving external stimuli, and then stimulus is basically where the excitation of the nerve occurs. Autonomic is involuntary. We are going to be reviewing some more of the autonomic nervous system today, including the parasympathetic and sympathetic nervous system. Neurons, what actually is a neuron? So here's, I also have the glial cells in the myelin sheath. So here's our picture. Axon terminal. Terminal means end. The cell body, this is where our nucleus is housed. And then we also have our dendrites, where messages are received. And then here you can see our myelin. If it is white matter, it's myelinated, meaning it slides faster, and then unmyelinated would be gray matter, which means the message doesn't transmit quite as quickly, which I'm going to touch on that again later. We went over neurotransmitters. These are chemical substances that transmit messages from across the synapse. Synapse is a gap between two nerves. Brain and spinal cord, these two pieces are protected by the meninges and cerebrospinal fluid. For the skeletal protections, we have the brain has the skull, and the spinal cord, the vertebral column protects the spinal cord. Meninges, these are the different layers that are found in your head and your spinal cord. This is your protection. We have the dura mater, the arachnoid membrane, and then the pia mater. And there's a nice picture of that. We've got our skull, dura mater, arachnoid mater, and then our arachnoid membrane, and then the pia mater, and then we have our actual brain. The cerebrospinal fluid is a clear liquid fluid. It's basically kind of like watery. This is an extra protection for the spinal cord and the brain. It provides like an extra, like a cushion or a shock absorber. This is where the cerebrospinal fluid is produced in our ventricles in your brain, and then you can see all the blue. That is your actual cerebrospinal fluid. And then the parts of the brain we discussed. So the top part, the big brainy part, that's your cerebrum. Then we have our frontal lobe, our parietal lobe, our occipital lobe, and then the temporal lobe. So again, this is just review. Cerebrum controls most of it. The cerebrum is broken. These pieces, thoughts, judgment, memory, emotions, those are all broken down later into the different lobes of the brain. We have our left hemisphere and our right hemisphere. Remember, these two are connected by the corpus callosum. These two hemispheres control the opposite side of the body. So your right side of your brain controls the left side of your body, and the left side controls the right. So the different lobes, you definitely need to know what these control. So the frontal lobe, I argue, is the most important. It controls motor skills, memory, and behavior. It also helps with your decision-making process, making the choices that you do make and how to proceed with those choices. Parietal is tongue and skin and muscles. These are your sensory receptors. Your occipital lobe, that's the eye that controls your eyesight. And then we have the temporal lobe, which is located close to your ear, and that controls sense of hearing and smell. And then again, here's just another picture of it to show you again where those are located. Then we have our thalamus, hypothalamus. Our thalamus is located just below the cerebrum, and then your hypothalamus is located below the thalamus, so it just keeps going down. The hypothalamus is responsible for all of these, so be sure that you review those. The cerebellum, which is the largest part of the brain, it's in the back of the head. It receives incoming messages regarding movement with joints, muscle tone, and positions of the body. I think I mentioned this in the first video, that if this is struck or hit the cerebellum hard enough, it can be fatal. You can pass away from being struck too hard in the cerebellum. Then we have our brainstem. We have our midbrain and our pons. These basically just transmit messages to and from the brain, and then it also helps control the movements of eyesight and head in response to stimuli. And then your medulla oblongata, medulla oblongata, that controls some of your spine survival functions, respiration, heart rate, blood pressure. It's a part of the autonomic nervous system. There's a nice picture of that. And then we have our spinal cord, which is just a long tube structure that begins at the brainstem and continues almost all the way to the bottom of the spinal column. We'll go over that a little bit more today, about where those nerves go. And then here's a nice picture of it. We have gray matter in here. And then here's the center of the spinal cord, which is where all the nerves are originally housed. So, moving on to the peripheral nervous system. We have autonomic nerve fibers. These carry instructions to organs and glands. They are involuntary. Autonomic means automatic, involuntary. We have these nerve fibers, they work without having to be told. You don't get to specifically tell these nerve fibers what to do. They automatically do it themselves. We have sensory nerve fibers. These receive external stimuli, and they're transmitted directly again to the brain through the spinal cord. And then we have our somatic nerve fibers. These are your motor nerve fibers. Somatic means movement or body. And these are voluntary. You can control these. So these are very different from your autonomic nerve fibers. Cranial nerves. These are also a part of your peripheral nervous system. The cranial nerves originate under the surface of the brain. They are all located in your head. There are two nerve pairs that are identical in function and structure, basically one on each side. That's what it means by two pairs, or two nerves. That's what it means. And then they're identified by Roman numerals. I believe we do get to this in the medical terminology book. There's 12 cranial nerves, and Roman numerals being I, and then II, and then IV. So if you don't know Roman numerals, check it out. Check out Roman numerals. We don't use them very much nowadays, but they're on some clocks. I hope you guys can read real clocks. I'm just kidding. I know you guys can. And then they're named for the area or the function. So based on where they're located or what they actually do, that is how they're named. So one example would be the olfactory nerve. Olfactory means smell. There is a nerve that is directly connected to your nose, and that's called the olfactory cranial nerve. That's just one example. We have the spinal nerves then. There are 31. These are grouped based on the region of the body they are innervated. So basically they go along with your spine. C1 to C8, T1 to T12, L1 to L5, and then S1 to S5. S being sacrum. So don't forget the sacrum. That is also a part of your spine. We also have our coccyx at the bottom of our vertebral column, but there are no nerves that innervate that. So we have our autonomic nervous system. I put this little animation in here. I don't know if oh no, it's not going to play. It was a cute little guy. He was running away from the tiger. I think that's a tiger. The autonomic nervous system is involuntary, so that would be an example of our sympathetic nervous system. Fight or flight. When we are put in a stressful situation, our sympathetic nervous system takes over. Our sympathetic nervous system is the fight or flight response, so you either fight whatever is stressing you out, or you flight. You run away from whatever is stressing you. This can be applied to homework. If you are stressed out about your homework, you can either fight it and attempt it and do it, or you can flight from it, which I would not suggest doing, because that's going to result in a bad grade, which is going to result in more stress, which then is just going to lead to further stress and future stress. So don't just do your homework, just do it. Your sympathetic nervous system increases your heart rate, your blood pressure, your breathing, and the blood flow. So it just stimulates the body, gets the blood flowing, gets the body ready to fight if it needs to. It's the body's response to danger, or like I said, to stress. This was used a lot back in the day when we were facing, times of hunger, and we obviously don't have this issue today yet. But in times of like danger or hunger, like if there was an animal chasing us, our sympathetic nervous system took over and helped to, get us through that stressful situation, run away from that animal, fight that animal. And then we have our parasympathetic nervous system. This is our rest and digest system. The rest and digest meaning it returns the body to normal resting state. So calming down the sympathetic nervous system, it's the opposite. It maintains daily processes. So it helps with your digestive system. Like I said, rest and digest. Your parasympathetic nervous system definitely has a influence over your digestive system. Moving on to our medical specialist, that's pretty much all you need to know about the autonomic nervous system, by the way. So we have a couple different medical specialists that I want to review. First, anesthesiologist. I hope you guys have heard of this term, anesthesiologist. This is a physician who specializes in administering anesthetic agents before and during surgery. So if you ever have to have a surgery or a procedure, you will receive anesthesia or an anesthetic agent. For me personally, I've experienced anesthetic medication when I was getting my wisdom teeth out. They put me under with anesthetics, and there was an anesthesiologist there who did that. He controlled the levels of anesthesia that was flowing in my blood. This is a very dangerous position. It's a hard job. It's just a very hard job because you can kill people with anesthetics. It is not that hard to kill people with anesthetics if they are not given the correct dosage. So these individuals who go to school for this spend a long time. They go to medical school. They are a doctor. Difficult career, but very rewarding. And then we have an anesthetist, which is a medical professional specializing in administering anesthesia, but they are not a physician. So this is kind of like an assistant to the anesthesiologist. This individual helps the anesthesiologist. They also have to go to school for a very, very long time. Yes, this is kind of like if you start with nursing or chemistry, this is a potential career. I have one friend who is an anesthetist nurse. They help the anesthesiologist administer anesthetics, which again, for me, that scares the living daylights out of me. I could never do that because I would not want to accidentally kill somebody due to an overdose of anesthesia. But if you can do it, great. I know that some of you are bright enough to be able to do this. Moving on. Let's talk about more of the nerves. So, neurologist is a physician who specializes in diagnosing and treating diseases and disorders of the nervous system. Ner or neuro means nerve, and then ologist means specialist. So obviously, a neurologist, you're specializing on the nervous system. That includes the brain, the spinal cord, the nerve endings. A lot goes into becoming a neurologist. And then we have neurosurgeon. This is a physician who specializes in surgery of the nervous system. You think of neurosurgeons as being surgeons who operate on the brain. Again, very dangerous career, but also very rewarding. Your nervous system is extremely important in your body. It controls it controls most aspects of your body. So going into one of these professions is very noble, and it's very, very difficult, but it is very rewarding and very noble. We have psychiatrists and psychologists. So these are very different. Psychiatrist, psychologist. I used to get these mixed up all the time when I was going through treatments for mental illness. Psychiatrist was the individual who gave me the medications. So a psychiatrist is a physician who specializes in diagnosing and treating mental disorders. They do have an MD, meaning they are a doctor. They went to medical school. They have a degree in a medical degree. And then they specialize in chemical dependencies, emotional problems, mental illness, and these individuals can prescribe medications. On the flip side, a psychologist cannot prescribe medications. This is someone who is more like a therapist. A psychologist is someone that is a specialist that evaluates and treats emotional problems and mental illnesses. They have either a PhD or a PSYD. So PSYD is a doctorate in psychology. PhD is just a doctorate. This individual did not go to medical school. They simply just have a PhD, which I still want my PhD. I'm still waiting to go back to school so I can get my PhD in exercise physiology. So I put this funny graphic in here. If you guys have ever seen The Emperor's New Groove, if you haven't, I would suggest watching it. It's a good laugh, and if you guys need to laugh right now, which I think you probably do, it's a funny movie. So headaches, woohoo, headaches. So cephalalgia. So this is just a plain headache. So if you want to sound super, super smart, tell someone you have a cephalalgia and see what they say. They'll probably look at you like you're a cray-cray person, but that's okay. Let me make sure I'm pronouncing that correctly. I don't want to give you mispronunciations. Yeah, cephalalgia. That's the pronunciation of that. Then we have a migraine headache. If you've ever had a migraine headache, you know it is the absolute worst. I personally have never experienced a migraine headache, but my mom suffers from migraines, so I've seen her throughout my life have many, many migraines. It affects mostly women. Mostly women are affected by migraines, and it can cause nausea, vomiting, sensitivity to light or sound. And then there is this warning aura, which I didn't know this, and there's like a disturbance prior to having one, and it can be like an epileptic seizure can be a warning aura or a warning sign of getting a migraine headache. And then we have a couple other types. One more type of headache. We have a intensely painful headache, cluster headaches. These can occur in the side. It can have like a side of the head pain. You can have tearing of your eyes, nasal congestion, and this one actually affects mostly men. So men get a headache, women get a headache. So don't tell me that men have it worse because you get cluster headaches. Women get migraine headaches. So These occur mostly in, like I said, clusters or groups. And then we have an encephalocele. Oh, yes, encephalocele. So this is a craniocele. Or it's a congestion of, there's a congestion herniation of the brain through the skull. So cele means what? I know I heard you guys say hernia. Cele means hernia. So there are two types of this condition. There is a congenital, which means it's present at birth. There is already a herniation in the brain tissue through the skull, or there's a herniation, which is basically just a protrusion of a structure that can happen later in life. And then we have a meningocele, a congenital herniation of meninges through defects in skull or spinal column. So this is if you already have a defect in your spine or your skull, there can be a herniation or a pushing through of the meninges, or there's basically tissue that's pushing and breaking through, which is not good. That could lead to brain issues, nervous system problems. Not a good condition. And then we have hydrocephalus. This is excess cerebrospinal fluid accumulating in the ventricles in the brain. So hydro means water. There you go, right there. So excessive cerebrospinal fluid accumulating in the ventricles in the brain. Basically, your brain is filling with water. Not good. This can occur at birth, and it also can develop later in life. And it's caused by, excuse me, we're yawning again. It can be caused by obstructions of the meningitis. So that would be inflammation of the meninges, and then we have brain tumors, and there are other causes that can cause this. And then we have our last two that I'm just going over. We have meningioma. Oma means tumor. So a slow growing and usually benign tumor of the meninges. Usually it's benign, so if it's benign, it's not a problem. However, if it's malignant or cancerous, that could be a problem because it can metastasize and move to other parts of your brain, other parts of your body, especially because it's in the brain. It has easy access. And then we have meningitis, infectious meningitis. That's what it's known as. Inflammation of the meninges of the brain or the spinal cord. So obviously, if we have inflammation of that, that's not good. This can be caused by a bacterial or a viral infection elsewhere in the body, and then it can be transmitted into the meninges. And it's an infection. You can get an intense headache and flu-like symptoms, and then there's also bacterial meningitis, which is less common, but it can be fatal. But like I said, it's less common, so hopefully that doesn't happen. But it can be caused by, spread of a bacterial or a viral infection, which obviously right now at this time, we are all washing our hands really, really well. So we should be able to stop the spread of germs and infections and virus, cough, cough, coronavirus. Please stay at home. So good news is you're probably not going to get this right now, especially because nobody's talking or seeing anyone else. So good news. Good news. Hold on. So that's all I really have for today. I'm going to continue to work on, making quizzes and worksheets for you guys. Please make sure that you are doing the worksheets at this time. I put one up, and then make sure that you're doing your daily check-in because I do have to take attendance. So if you're not checking in, then you're not getting your attendance points. This is all we have for this week. Next week we will be on spring break, so make sure that you have a wonderful spring break of staying in your in your house or your apartment, wherever you're living. Be sure to stay there. Don't go anywhere. stay quarantined. Just don't stop the spread of coronavirus. We can't afford to get more people sick. I think that's all. I'll talk to you all soon.